Here's how I had a vaginal birth with an epidural in Kenya. So we recently celebrated our son's second birthday, and I chose to look back and share my labor and birth with an epidural story, since at that time I didn't have TikTok, and in any case, better late than never, right? So back to the story. My threshold for pain is very low, so when I found out I was pregnant, I started doing research on the different pain relief options during labor and delivery. Now, there are quite a number of labor pain relief options out there. Some are non-medical and others are medical. I'll focus more on the medical because that's the one I chose and used. When I was having a discussion with my gynae on the options to use, he had highlighted gas and air, pethidine injections, and epidural, and he went ahead to outline the side effects and how each option works. So considering my threshold for pain is very low, I needed an option that will ensure I feel little to no pain during my labor, and so I settled for an epidural. So what is an epidural? According to Google, epidural is an injection of local anesthetic in the space around the spinal nerves, please note, not the spinal cord, and it stops you from feeling pain in any part of your body. Epidurals are given by a specialist doctor called anesthetist. So when I tell people I gave birth with an epidural, I get some asking me why I chose to give birth by a cesarean section, and so I explained to them that no, I didn't give birth by a CS, rather I had a vaginal birth, but I had the epidural for pain relief. So on May 30th, 2021, I started having contractions, and so my husband and I took our hospital bag and we drove to the hospital. I had attended my antenatal clinics at the Nairobi hospital, and my husband and I chose to have our baby delivered there. We didn't have so many options anyway because very few hospitals in Kenya offer epidural injections for normal stroke vaginal delivery. At the time of my research, I had identified the Nairobi Hospital, Aga Khan, Mpisha, and Coptic hospitals as hospitals that offer it. The other thing I noticed during my research is the epidural injection is quite expensive. At the time, Coptic were charging 25,000 Kenya shillings. Aga Khan, I can't remember, but it was over 40,000 Kenya shillings, and we personally paid 55,000 Kenya shillings at the Nairobi Hospital. Please note that this cost is only for the epidural injections, so when you add the delivery cost, the total hospital bill is high. So May 30th, 2021, at 9 p.m, we check into the Nairobi Hospital. I explained to the nurse that I'm cramping and I have spotted the blood issue. The nurse goes ahead to check my cervix and I was 3 to 4 centimeters dilated. So I get admitted, ready for delivery. I was served dinner which we had to share with my husband since they had confiscated all our snacks at the gate. Time went by and my contractions intensified. It was just me and hubby in the room most time because the nurse would come, check on me and go. I remember at 12 a.m. the nurse came to check on me, and at this point I was in so much pain. The nurse looks at me and I could see the pity on her face, and she asked me, "Do you need some painkillers?" I answered very quickly with a yes, so she left the room, and 2 minutes later she came back with drugs and needles. She mentioned that the drug is called pethidine and it will help me with relieving the pain and also maybe help me sleep. So she injected my thigh with it, and after some minutes I felt like I was high on marijuana. My husband was talking to me, but I was seeing him in twos. The drug was so good that I fell asleep. At 6 a.m, contractions woke me up. I think at this point the pethidine had worn off. So nurse comes to check how far I've dilated, and I was at 6 centimeters. She went ahead to break my water, and so far, this was the most painful thing. The anesthesiologist, that one, came, and it was time for him to administer the epidural. It's advised to get it when you're dilated 6 centimeters or more. So of course with any medication there are side effects, and so before he could administer the injection, he had to take me through the procedure, and after I had to sign some papers for consent. So after signing the papers, my husband was asked to stand in front of me. I was seated on the edge of the hospital bed, and I was asked to put my hands around my husband's waist and curve my back. The anesthesiologist went ahead to disinfect my lower back, and I felt a sharp needle pain at this point. He explained that that's a numbing injection so that he can administer the epidural. And from there, I didn't feel any other pain as he went ahead to now administer the epidural in my body through a tube that he had taped safely on my back. All this while contractions would come and I would alert him, he would stop and continue when the contractions were gone. The epidural medicine is quite chilly, and so I could feel it move within my body, and in a few minutes, I realized I didn't feel any pain. At this point when contractions came, I would feel the pressure, or rather, my stomach would be very tight, but no pain at all. The anesthesiologist asked the nurse to check how far I was dilated, and at this point, I was up to 8 centimeters. They finally went ahead to insert a catheter down there for my urine. They left the room but asked me to ring the bell when I feel the urge to poop. So I remember at this point, after like 10 minutes, I was feeling so much pressure, but I was very hesitant to ring the bell because the lady inserting her fingers down there to check how far dilated I was very uncomfortable. I tried to hold the feeling of pressure, but it was too intense and I had to ring the bell. When the nurse came to check my dilation, I remember her quickly calling for help and I was rushed into the delivery room. I got to learn later that the nurse saw my baby's head when she came to check on me this final time. So the strong feeling of pressure was my baby pushing down. So now, 9 a.m., I'm in the delivery room. I have an epidural. The anesthesiologist is there to monitor, a doctor, nurse, and my husband, and it's now time to push my baby out. So the nurse kept playing with my stomach, and after some minutes, she would tell me, Marion, there is a contraction, push. I would push. When the contraction is gone, the nurse would ask me to stop. All this while, guys, I wasn't feeling any pain. Literally, I would feel the pressure, but I didn't have any pain with it. The nurse kept doing her thing, and my husband at some point, I remember him saying, oh, babe, I can see his head. He has so much hair. Oh my God, push. And that really made me excited. 30 minutes of pushing and 9:30 a.m., 31st May 2021, our baby boy was born, weighing 3 kgs and in perfect health. Once the baby was out, I thought I was done, but the doc delivered the placenta and after she started stitching me. Apparently, the doc had given me an episiotomy. An episiotomy is a cut down there to increase the birth canal so the baby's head can fit through. Not all women get it, and some women just stare on their own as the baby tries to push out. I didn't feel pain with all this since the epidural was still in my system, but with the stitching, I could feel the thread going in and out, but no pain. All in all, I had a very drama-free, pain-free childbirth, and it's all thanks to an epidural. 10 out of 10, I would recommend it to anyone who can afford it, and their threshold for pain is very low like me. After I was cleaned up, I was wheeled to my room with our baby, and I think an hour or so, I could feel my legs and even went ahead to go to the bathroom and take a shower. I would honestly do it over and over again with an epidural in a heartbeat. We were discharged the next day, and I am forever grateful for my amazing childbirth experience. I'm sharing this to help a mama out there, so feel free to ask any questions you have in the comment section, and I will answer from my experience and to the best of my knowledge. As always, remember to be kind to one another, love one another, and treasure every minute you spend with one another because tomorrow is not promised. Ciao!